Hello, everyone. This is David Ellis on the Integrative Health Network, and I'm here with a longtime friend of mine. Her name is Amy Kruzic. Amy, say hello to these people.
Hello, everybody.
All right. So what we're doing today is Amy has a bunch of questions for me. We got into a discussion some time ago, and I said, why don't we just do this on a podcast? Because lots of people don't know these differences. So Amy is actually going to be interviewing me today more than I am interviewing her. Amy is a trained counselor. Amy, tell these people a little bit about yourself.
Yes, I have a degree in business administration, and I am a certified CBT counselor and hypnotherapist with the International Association of Counselors and Therapists, and a podcaster.
Mm-hmm.
Yeah.
She's also qualified with the Professional Board of Hypnotherapy here in Canada. Okay, Amy, I believe you have a bunch of questions for me. Let her rip.
Okay, so we're going to talk about PEMF mats.
Mm-hmm.
We're going to talk about Lucia Light, number 3, and the red light therapy. So, yes, because that you have these in your clinic. Correct? Okay. So, I'd like to know about the evidence-based versus the speculative base of all of these.
Okay. These are very interesting terms. When we say evidence-based, what we're talking about is, let's say if you're talking about therapy, you're talking about therapies that have undergone rigorous testing. Evidence-based is a standard that you try to live up to. What it means when you say therapy or modality is evidence-based, it means that that modality has been shown over clinical trials and studies to work for the majority of people. So you bring a bunch of people of different ethnicities and so on into a study. You test the modality on them, and then you can tell that this modality works for this particular indication or this particular problem or barrier. Okay. Now, speculative modalities, what they do is they might work. I suppose there's a difference between things that will definitely work and things that might work depending on who the person is. So when you say speculative, you might be talking about some modes of energy healing, some of them. Things that might work. I don't know. Dancing around a fire might work for some people. It may not work for others. Does that make sense?
Okay, that makes sense.
It depends on the person's faith, basically, in dancing around the fire.
Yeah. Okay.
I suppose, I suppose evidence-based versus speculative is that which will definitely work and that which may or may not work. Now, there is no judgment based on the evidence-based versus the speculative, but a lot of people tend to bend towards evidence-based application simply because when a client or a patient comes to you and they're spending money, all they want to know is, will this work for me or not?
Yeah, let's just throw in like Reiki and massage.
Okay.
So with the 3 that we mentioned before, so let's say that massage could be speculative because, well, that didn't work. It was too much for my body, right? So
yes.
Okay.
But massage therapy as a modality has been shown to work in a majority of cases. And that's the standard. So people get caught up on the idea of evidence-based because they think it's only doctors and nurses that practice evidence-based modalities, whether it be pharmacology or whether it be surgery, as an example. Surgery will work because if you have a tumor, you cut it out. The problem is at least temporarily solved. Having said that, tumors tend to grow back, right?
Yeah.
Now, the thing about it is that when you're talking about speculative science, massage therapy would not necessarily fall into that category. And there are a number of other underpinnings of something that is evidence-based. So as an example, An evidence-based modality would have an association or be regulated by the state. So massage therapy would be a regulated profession. Here in Canada, it would be a regulated profession in North America, I believe. Not so much in the United Kingdom, and not so much in most of the third world countries, but it is widely recognized by people as something that works.
Yeah. Okay. So let's go into the PEMF, which stands for Pulsed Electromagnetic Field Therapy, which the one that you and I like is the IMRS by Swiss Bionics, and they are FDA approved.
Yes.
That particular one is.
You see what? Yeah, but you see what you just said there. FDA approval means that it has undergone some kind of testing and been shown to work.
Yeah.
So, as an example, there are lots of PEMF mats out there. Yeah. And a lot of them are marketing gimmicks. Like, especially you have mats that have crystals in them. They sell it to people for between $600 and $1,000. Okay. Now, they may work depending on the individual, but they haven't undergone a lot of rigorous testing. So I don't really think when we say evidence-based, it's a matter of whether that company had the money to do the rigorous testing and get FDA approval, which is not easy to do.
No.
You need at least $50,000 to get even into a state where you can get that approval. So that is a very difficult process and a high standard for a lot of companies. It doesn't mean that the mats do not work, but let's face it, there are some people out there, nefarious manufacturers, who would absolutely rip people off specifically because they can.
Yeah, so they don't need any they could use all the pretty words that people want, you know, and how do you, between the IMRS and somebody else, there's other, I forget the other names, but
yeah, well, there are lots of other mats out there. I don't want to get into necessarily the names, but quite the majority of them are fairly useless. I will explain to you why that is. When you say pulsed electromagnetic field therapy, what you're looking for is a variability in the frequency output. A lot of these mats, they change poles, north and south. Okay, so as an example, if you have a mat that is generating a static electromagnetic field, then the mat is good for relaxation.
Yeah.
It's not good for too much else. Okay. And then there's the other part of it is the strength of that field. Yeah. That field has to be sufficiently strong to affect body tissues. It's kind of like buying an over-the-counter ultrasound device, right? And going to a physio and getting ultrasound from a physio. The strength parameters are absolutely different between the two, right? I have an ultrasound machine in my office as an example, okay? You feel that ultrasound when the handle is put too long. It actually heats up body tissues. A lot of the stuff that they do sell over the counter tends to be minimal at best. It's not going to penetrate to the depth that you need it to penetrate. It just isn't. But it's an interesting waste of money a lot of the times.
Okay, so so what I'd like to know, I'm just going to ask you a few questions about the PEMF mat. How does the dosing protocol work, like the frequency, the intensity, the duration? And can you break it down into what is actually doing inside the body, like in simple terms for people?
Okay, absolutely. So any electrical field has an electromagnetic field. It's a field around the electrical field. So when we were young, we had those tube TVs or those tube monitors, and you turn the monitor off and you put your hand by the monitor and the hair on your hand starts to stand up. That is called an electromagnetic field. Any electrical field has an electromagnetic field. Your body is an electrical field due to the fact that what's making your nervous system function is electrical current. Let's not get it twisted. It's a low-grade electrical current, but it is electrical current nonetheless. Okay? And what happens when you feel that electrical current from, this is how you feel other people's inverted commas vibes, so to speak. Mm-hmm. So the electromagnetic field used to be called, back in the day, we used to call that the aura. We used to call that the whatever, and Kirlian photography could take pictures of the aura. Okay?
Yeah.
We used to call that the aura back in the day when all of this was speculative. This is not speculative anymore because it has been tested, and we realize, oh crap, the electrical field that the body produces does have an electromagnetic field. Now, what PEMF does, it takes the frequency, because everything is frequency. Your mind, as an example, has a particular frequency. The colors that you see, that's frequency. You're using a frequency to hear my voice. Everything in life is frequency. And so what it does is that it takes frequency and it knows what frequency creates optimal health and tries to entrain the body back to that frequency.
Yeah.
So we know that it definitely works because it's been tested over and over again, right? So I'll give you an example. The reason why an MRI can see through your body is an electromagnetic field is synchronized to your electromagnetic field, and the imaging is the result of basically magnetic current running through you. Okay? And it's not a little bit of magnetic current, it's a lot. You don't go into an MRI chamber with earrings on, let's put it that way.
Right.
Or glasses or anything that is metal at all. Right? Yeah. So it's a lot of magnetic current that is being run through you. So a PEMF mat does something along the same lines. And once again, it's not a matter of whether it works or not. It works. That's just as simple as that, right? It's a matter of how you use the mat and whether or not you are proficient in using the mat, which requires a little bit of training, but that's neither here nor there.
Yeah. Okay, so let's say somebody comes into your clinic and they have these conditions. So how do they, okay, so let's just say they come in with osteoporosis.
Mm-hmm.
Okay, so let's say I'm just coming in and trying it. Let's see if it works. Well, how do you know if it's working? How can people understand how it's working? And after they're done with the session, mm-hmm. What should they pay attention to? Mm-hmm. The changes that they see. Mm-hmm. So yeah.
Okay. PEMF mats, they will give you relief from major symptoms. They're not going to cure cancer. They're not going to cure osteoporosis, as an example. Now, osteoporosis is basically a state where via aging or genetics, your bones become porous as a result. Okay. The problem with osteoporosis, 9 times out of 10, why somebody would see you for osteoporosis is the pain. The mm-hmm. unmitigated pain from osteoporosis are usually affecting the hip, the lower back, and the knees. Okay. And so what you can do is give that person some relief from the pain that they are experiencing, utilizing a combination of therapies like PEMF and, ultrasound or PEMF and far infrared.
Okay.
So these are the things that would work specifically. And, well, PEMF is wonderful for pain reduction from chronic illnesses. Absolutely.
Yeah, and it's also good for like inflammation and insomnia. Mm-hmm. So so then let's say, all right, I tried it, I liked it. What would you recommend? How many times for them to come back and try it?
Yes, this is the thing that most people don't seem to understand. Let's say you have a particular habit pattern that has put you into a condition. Everybody wants the kind of KFC type healing. You drive through, you pick up your healing, and you drive out. No. If you have a habit pattern or condition that has taken weeks and years to come up, you're going to have to commit to the training. Commit to the healing. So we're looking for something like osteoporosis. You will receive some relief the first time you are there. Okay?
Yeah.
But you want a little bit more management of those symptoms. So, together with your healthcare professional, they will absolutely talk to you about your diet and how to manage the pain yourself. And they will absolutely put interventions in place like PEMF, ultrasound, and stuff to reduce pain and suffering, right? So that the tissues learn how to relax. So, we're talking about a minimum of 3 to 4 sessions. And that is the realistic outlook, right?
Yeah.
Spaced out, of course, but we're talking about a minimum of 3 to 4 sessions. Generally speaking, it has been my experience that when people experience PEMF, they tend to like it quite a bit.
It is nice,
It is
I have
extremely,
to say.
it's relaxing. It resets your nervous system. And so people use it just for that. It's like, forget about the osteoporosis. Just let me get on that mat, right?
Yeah.
So there is
We
that.
forgot about the brain entrainment. We forgot about the brain, the goggles.
Oh yes, I keep forgetting that Amy has an
Yeah.
IMRS mat down in
Yeah.
yeah, okay. So the other part of the PEMF mat, if you are using a high-end mat, is the brain entrainment. Now I mentioned earlier on that the nervous system um it offers some relief to the nervous system and it resets the nervous system. Well, the controller of the nervous system is your brain. Okay. And so when it is that you are on a PEMF mat, the IMRS mat or the Swiss Bionics mat that we use in professional practice, what it does is that it has a brain entrainment system, which is a pair of goggles and a neural headset that you put on to yourself. And the lights inside the goggles, they tend to step you down in terms of the frequency and the activity of your nervous system. So it is a wonderful use of both the controller and the master controller, which is your brain, and the rest of your nerve endings and nerve fibers throughout the body.
Yeah, I have to say, when I first used the goggles, I had to lower the intensity. It was like too much.
Yeah, it can be a lot.
Yeah, and now I'm up to, now I can do it full on.
Yeah, because your tolerance is there are not too many people buying Swiss Bionics mats, therapeutic grade mats, Amy.
I
So
know.
there's that.
I know. Okay, so let's move on to the Lucia light, number 3,
Mm-hmm.
the hypnagogic light machine, which was developed by a neurologist, right?
Yes, it was developed by a neurologist.
And they're flicking light patterns. Can you explain how it works and what actually happens in the brain during a session?
A lot of people don't know what Lucia light therapy is. Okay, so when it comes to neural science, we have like different levels of modalities and therapies. So the Lucia light is another evidence-based device, and what it does, it basically creates light patterns for your mind. It basically is a, how should I say, a light show for your frontal cortex. Now, I think I've said this over and over again, but I'll say it again. A lot of human beings think that they're complex. I'm a complex being. No, you're not really complex. What it is that you are a very, very complex houseplant and you need light.
Yeah.
So the thing about it is that light is a very important construct, not only just for your skin, for your mental health as well. For people who live in dark climates and so on, they have found that a little bit of light changes their mood considerably. Okay. These are studies and studies that were done on people with light deficiencies. Okay. If you live in Finland, you may not see sun for a little while, right? If you live in the Arctic
Right.
areas, it becomes a real problem. And so, what we do in terms of Lucia light therapy, it's a hypnagogic light, meaning that there's a hypnotic or a trance induction effect that the light does bring with it, which relaxes your nervous system. There are no colored lights in there. Your brain creates colors and patterns. And it sends you on a very, very cool, for want of a better word, I don't like using this term, it sends you on a very cool trip into your mind. And so a lot of people tend to like the light because it dissociates you from the effect of trauma and the problems that are in your mind. It moves you away from it, right? So the light is used for PTSD, primarily in therapeutic care, but it can be used as a extremely effective stress reduction device.
Yeah, I was thinking like who tends to benefit most from it? I was thinking like PTSD, anxiety,
Mm-hmm.
those types of things, addictions.
Most neurologically born issues, chronic issues such as anxiety, right? When your nervous system is in afraid, people who live in hypervigilance, always frightened all the time.
Ah,
Phobias,
yeah.
it would be used for that as well. So if you think about what you would treat with hypnosis, all of those things can be treated with a Lucia light because the skill level of hypnotherapy is taken out of the equation because the light will do the induction for you.
Okay, so again, coming into your office, and I want to use the Lucia light to experience that. So first of all, let's talk about filling out forms. Should always fill out forms for any of these things we're talking about.
Yes, there's an informed consent. A lot of people, and here's the thing, when you go to a practitioner, the things that you're looking for in a practitioner obviously is a certain amount of training. And the training will be demonstrated immediately because the practitioner will talk to you. They won't tell you, here, stick yourself underneath the light. They will talk to you before, whether it be in the office or before or consult. And they will ask you questions such as, do you have epilepsy, which is contraindicated. Contraindicated means that it's not for people with epilepsy, so to speak, right? Because there are flickering lights, right? It's the same way you wouldn't want to do, I don't know, a certain massage therapy techniques on people with diabetes or people with lymphatic cancers, right? So this is where the consult becomes very important, and the practitioner will ask you these questions, and then they will put you through a pilot program, and then they will probably use the intervention.
Yeah. So take me through. I'm coming into your office because I have no idea how long should I be under this light if it's my first time. Do I listen to music? Do I not listen to music? What are you doing while I'm under the light? Are you observing?
Okay, so when you're doing Lucia light therapy, it would follow the same protocol as a hypnotic technique, but there's a little bit more agency given to the client. So, as an example, if you are in a Lucia light session, you would be taken through a consultation. The practitioner would put you through a pilot program to see your tolerance of the light. Then, if that goes through swimmingly, the practitioner will then take you through a sort of intervention, a basic intervention. And what that looks like is the practitioner will put you underneath the light, wait for 5 minutes, and try not to be in your personal space when it is that you're dealing with the issues that are inside your mind. This is what I mean by agency is given over to the client, right? To basically handle a lot of the stuff that is happening with them.
Yeah, and how long do you think? It depends on the people. It depends on the person.
Honestly, when somebody is new to the Lucia light, I would only run that Lucia light for 20 minutes because time dilates the deeper you go into trance. So as an example, 20 minutes in our speaking time would be equivalent to probably a few hours in dream time, so to speak. So that's the time dilates the deeper you go into trance. Yeah.
Yeah, and I'm thinking that it would actually be good for people who are going through a grief process.
Correct.
Or
Exactly.
emotional. I think it also helps with like emotional releasing.
Yes.
Is it like a somatic release?
It is a somatic release in that the nervous system is directly affected.
Okay.
The nervous system is directly affected by light. This is something that we have come to understand because, well, the light has been studied and studied to death. The nervous system is directly affected by light. Our ancestors knew this. That's why everything was done by the fireside.
Ah.
Okay.
I like that.
That's why everything was done by the fireside. Whether it was some magical ritual or whatever, there is something to be said for flickering lights. So there is that.
Mm-hmm. Mm-hmm. Well, I think we can move on to the red light therapy. Now, I thought that this was, what did I think that was? Infrared? It's different. I thought it was like, I thought red light was infrared.
Okay, I want to give some information here.
Yeah.
Guys, there are 3 different kinds of red light. There is red light therapy. There is near infrared. And there is far infrared. Okay. Red light therapy, such as your little LED masks and the little handheld LED red light therapy devices, they produce red light to the spectrum of 600 to 700 nanometers per waveform. Okay. Near infrared, NIR, right? Mm-hmm. Produce spectrums between 700, most likely 740, because at 700 you're not really saying a lot, right? Between 740 and upwards to what, 2000 nanometers, right? Far infrared produces spectrums from 3000 all the way up to 100,000. Oh. Okay, now I will explain the difference. You use red light therapy when you want to reconfigure skin. All of these lights will go through the body. Absolutely. Okay? Yes, because people don't think of their bodies as porous, but they actually are.
Yeah. Yeah.
Right? That's why you have a skin full of holes called pores. Okay?
I know.
You have a skin full of holes because things have to get in and light has to get in as well. That's why vitamin D is actuated by exposure to the sun. So red light therapy, what it does is, if you want to treat like skin conditions and such like, you would use red light therapy. Okay? Down to the epidermis, you will absolutely, it's wonderful for that, which is why LED mask exists. I want to say something about that again. I'm going to put a pin here and stick a pin here.
Okay.
For those of you who are using LED masks for beauty and such like, more is not better. Okay? Like, if you think you're going to keep that mask on for the whole day so that you could be like Snow White, mirror, mirror on the wall, who's the fairest of them all, it is probably a huge mistake. Okay? That's number 1. Number 2, a lot of the red light therapy devices are scams. If your mask costs $20,
yeah.
If your mask costs $20, then it's little LED bulbs that are red. Actually, they're not even red. They're just underneath a red filter, right? The best maker for these kinds of beauty devices is a company called Kala, Kala, Kala Light Therapy. You might want to check them out. That is a company that I can absolutely recommend unless you're using a medical grade device like the one in my office, which produces true red light. My suggestion for people who are utilizing these kinds of devices, go to Kala, absolutely, because it's a hit or miss, like the PEMF mats. They are unscrupulous manufacturers that will do whatever they need to do to make a buck. So I'm telling you that certain LED masks are not a good idea.
Yeah. So
if you want to deal with muscle pain, you would use near infrared because it'll go into the muscles, the deep tissues. And if you want to go really, 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 really deep, you use far infrared, which is part of actually the IMRS mat, which uses far infrared, which means that the heat from that mat will go straight through your body. Absolutely.
Okay, so let's go back to that. The red light therapy and the IMRS mat, they go right to the mitochondria, right? Of the cells.
Correct.
Oh, so, and I think that's the...
And here's the thing.
Yeah.
When your cells are happy, you are happy.
Yeah.
If your cells are not happy, you are not happy.
Yeah.
Okay. People tend to think of health as this big overarching thing. Now, I do DNA testing in my office, right? So I could pretty much tell you that it's the small things that matter.
It's the small things.
Right. Because you could be like, have everything going on in the world and still suffer from depression because, I don't know, you don't get enough light because your cells aren't happy because you're not a good house plant. You're not outside. Right. Yeah. And you could be the world's happiest. You have everything going on and still be miserable. And it's because your microbiology, whether it be your microbiome, that is your gut health, is not happy. You are not happy. You will never be happy.
Yeah. Okay. So what do you say to the skeptics out there that say, I don't know if I buy this?
By what? Which
all
one?
Like I'm skeptical of these devices.
Then I would have to resort to saying evidence-based.
There you go.
Means that it works for everybody, not just you. And the skepticism, and part of the skepticism comes because a lot of people, they tend to have been sold a bill of goods by people who are unscrupulous. I'm talking about the manufacturers and so on. Okay. They tend to be they were tricked, swindled by other people and so on. My suggestion to anybody who is considering taking any modality, I don't care whether it's surgery even, is to read about your health and do not outsource your health to any professional, including myself. You have to read about what that therapy or modality is. This is what patient agency is about. I can absolutely sit here and wax poetic about the wonders of near infrared and far infrared technology, but it is a little bit different if you go on sites like PubMed and read the research as to what is indicated for X, Y, and Z, and is it going to work for me based on my particular condition. Patient agency is important. Let's say I go to, I don't know, Jane Doe down the road. Here are the things that I would want to know. I would want to know, is this therapist qualified to do what they say they're qualified to do? I would want to know if the modality is actually what is indicated for me. Because whether it be speculative or evidence-based, once again, I told you, the difference between some of the times, most of the times, the difference between speculative and evidence-based is that a lot of the evidence-based companies had a lot of financial backing to get themselves tested and peer-reviewed. So it's not that certain sciences are not for you because they don't fall under the category of PubMed. It is a simple matter of there wasn't enough research done on a particular modality, and that's very important.
Yeah.
Yeah.
I agree. I agree that, go to, I'm going to say like shop around, because what if you don't connect with that person or that person, something red flag, this doesn't feel right.
You see, here we get into another very important thing.
Yeah.
I am going to say this. Saying something is evidence-based is one thing. I don't care if you went to the world's best surgeon. He has like lots of cool Yelp reviews. He has done this study and that study and whatever the case may be, and he may be the best surgeon known to modern man. If that man is not compassionate, and understands what you're going through, or makes an attempt to understand. And this is what is happening in conventional systems. We're probably going to do another a talk about that. This is what is happening in conventional systems. People are being treated like a number, and it's not necessarily the therapist or the doctor's fault. It has a lot to do with the fact that the healthcare system is over encumbered. And so when you go to a doctor and he spends exactly 20 seconds with you, what's your story? What's happening? Okay, right. Write a prescription, get out of my office.
Yeah.
There's that. So there is a certain amount of connection that has to happen between the therapist and the client. And I've given a little bit of stick to the therapist side, but let's give a little bit of stick to the patient client side. You are responsible for your own health ultimately.
Yeah.
A lot of cancer patients learn that very, very early when we say to them, yes, you can undergo stuff like chemotherapy or biotherapy, but at the end of the day, it is up to you to reduce the stress in your life, to build a supportive community, and all of those things. We say these things to people specifically because your health ultimately is at you. It's not in the hands of a doctor, a therapist, or no matter how well they're trained, no matter how good they are, it's not in the hands of a surgeon. So, as an example, if you are undergoing treatment for lung cancer, as an example, okay, the onus is on you not to continue smoking. I would hope not.
Mm-hmm.
If you are going to get lipo surgery for, I don't know, removing adipose tissue, right? That's fat around the midsection. If you're undergoing liposuction or such like that, the onus is on you to exercise and not continue a particular health pattern that leads you down the road to obesity. These are the kinds of things that I think are important. So patient and client agency is absolutely important. If you're going to do some modality that involves dancing around a fire, there are lots of research done specific as to why it would work and why it would not work. It is as simple as that, right? But if you put your faith in people, then you're going to be disappointed at least some of the times. And is that a risk that you want to take for your own health? That's what I would say.
Yeah. I think it helps to have that compassion for yourself, and compassion with your doctor or whoever, and just have that I don't know, what do you call that, like co-regulation? I don't know, something like that. You just know. At least that's for me. You just know when it feels right. This feels right. Okay, let's try it.
Yeah, there's something else that I want to say. A lot of professionals, especially in the conventional spectrum, they do an emotional distancing from their clients. The client feels like, I'm a number to you, right? I am some information on a chart to you. I think bedside manner should be taught in any modality. What is bedside manner? Making people feel like people. Seeing them is a very important part of the therapeutic process. Because if you're going to treat them like an anatomy subject, then there are going to be minimal results, or there will be some sort of residual trauma that happens when you're cutting them open, sealing them shut, checking them, giving them pills and so on, and not even knowing, like making eye contact as an example.
Yeah, the little things.
And eye contact, the ability to talk to people like people, hear their stories and so on. You may not have a lot of time, but you have 30 seconds to say, how are you feeling today? Okay. And not like, how are you feeling today? Let me just write it down on the chart. I mean, like, genuinely, how you're feeling. And so these things are important, I think.
Yeah, I do too. I agree. Well, this has been great. Yeah.
Yep. And I also wanted to talk about one more thing, which is the neural sync system that we're doing. We're probably going to do a group dynamic. We have a neural sync system. We're calling it HS1. And that's something that is coming up very, very soon. We have something planned for the 29th and the 30th of May. For those of you who are interested, you can check that out.
Nice.
Yep. And I believe, Amy, you have a podcast coming up, don't you?
I do, but I'm not saying the name yet. But but you can reach me at shinytalk.pod@gmail.com.
Excellent. Thank you,
Yeah.
Amy, for asking me these questions. I hope that we inform the audience a little bit about
Yeah.
how health matters and how it works
Yeah.
in terms of, different therapies and so on.
Oh, thank you so much, everybody.
All right, take care.
Bye. Hi, everybody. This is Amy Kruzic. I am a certified hypnotherapist from the International Association of Counselors in Therapy and the Professional Board of Hypnotherapy here in Canada. I am here to announce the opening of our new Unified Health Systems online store, where you will find professional courses and done-for-you products at reasonable prices in the market. Check them out at shop.unifiedhealthsystems.com. Bye, everybody. See you there.